Happy and welcome to Tuesdays with Tina. We are coming live today. It is April 30th of 2024, and today's topic stems from a couple of other things that have happened in life. But the goal is to discuss medications and how they relate to local anesthesia, a little bit about post-treatment pain management, and maybe something else if there happens to be a question that comes up. So, again, it's Tuesday, April 30th, and welcome to Tuesdays with Tina. Hello, Instagram. Happy to see you guys there, and Facebook. Hello. Happy to see you all here as well. And as always, this is getting recorded and will be put onto the Teacher Tina RDH YouTube page so you can go back and review anything. And I've enjoyed it, and it's been kind of nice for people to be able to go back and see some of the past episodes of what I've talked about. It makes it easier than trying to scroll through social media, right? Sometimes we get lost in that realm. So today's topics, medications and how they relate to local anesthesia and post-treatment pain management. The impetus, the driving force behind this topic really stems from my own personal life experience. My cat went to Kitty Hospital this weekend, friends. My cat went to Kitty Hospital, and it was hard, it was traumatic, and it was intense. He had a really bad bladder infection and had a blocked ureter and was unable to evacuate his bladder, and it required a vet visit, like an emergency vet visit. So it made me start thinking about what are they doing to treat the kitty, and how does that relate to some of the things that we have here. And right around that same time, getting the list of all the medications that they gave him, and then coming across journals and information about some of the changes that are happening in the world of anesthesia in regards to those who are on GLP-1s, like the Ozempic and Trulivity. I can't remember the other ones' names. Anyways, how that relates with local anesthesia as well. And I was like, it's been a while since we've talked a little bit about local anesthesia and medications, how they relate to each other, why we want to look at that. I will say, if you caught that, yes, my kitty is doing better. He's home and he's still a little sedated. They gave us some gabapentin to help with some pain management, gabapentin and the kitty cat version of ibuprofen, which when I was researching gabapentin in and of itself for cats, I also came across some information about what gabapentin is currently being used in the world of dentistry, combining gabapentin with NSAIDs to help with pain management for post-dental treatment pain, which I thought was pretty interesting. So that's one thing that I think that we're going to start seeing more is our doctors, whether it's a general dentist, our oral surgeons, prescribing a combo drug instead of using something like an opioid family, using something that's more like a gabapentin and other combination of drugs to help with post-treatment pain management, which maybe might be okay. Oh my gosh, you guys, seriously, this is live. Right outside my window, I'm watching a crow tear apart a hummingbird. Oh my gosh. That was the craziest thing I've ever seen. Sorry. I didn't mean to literally go off topic, but that was the craziest thing I've ever seen. Wow. Okay. Sorry. That totally threw me. I think that was pretty intense. Nature at its best or worst, I don't know. So, back to what I was talking about. Gabapentin. My kitty's on gabapentin, which led me down the road of researching medications and seeing that gabapentin is being used, starting to become up and being used in dentistry as a post-treatment pain management option, combined usually with some other medications like an NSAID. So I think that's interesting. I'm curious for any of you here that if you're starting to see some of that being incorporated into your practice. So I thought that was interesting. The other thing in regards, while we're on the topic of post-treatment pain management, I'm just curious what you guys are doing in regards to your pain management for your periotherapy patients afterwards. There's so many products that are coming out, to be able to use with it. There's always the old standby of a moist black tea bag and having the patient put that in their mouth to help with bleeding, to control bleeding, post use bleeding. But there's some that say it also helps with post treatment pain management. So I thought that was kind of interesting. I always think that it's kind of cool to use like a fluoride varnish or something like that to help with some of the post dental sensitivity. I'm curious, do anybody, do any of you guys do fluoride varnish for post treatment pain sensitivity for the exposed root surfaces? Something that's kind of technically, as hygienists, that's what we use it. That's what it's been marketed for, not for caries management, but for dental sensitivity. So we're actually within our realms to be able to apply this post periotherapy to help with dental sensitivity. But then there's also other washes, mouth washes that are out, like OraSoothe. I know that Septodont has a product called OraSoothe that helps with post-treatment pain management. It helps soothe the gum line. There's another company out, BioValence, I think is what it is they have a post-treatment mouth rinse that can be used for, or a mouth rinse that can be used for some post-treatment pain management and mouth sores, those kinds of things. So I think it's kind of interesting for us to be thinking about that. So many times we're considering our pain management for the treatment, but not so much thinking about after treatment, what's the pain management that our patient's going to experience. I know for me personally, historically, I used to always tell my patient, whatever you normally take for a headache, you can go ahead and take for this. But I think that taking some extra steps to help them to have reduced dental sensitivity, reduced gum tissue sensitivity, I think is totally worth it. And it might be worth having a few extra take-home products to help them out, because I'll tell you, it sure has helped with me and working with my kitty with his after being in kitty hospital for 2 days, having something to help with him for post pain management. He had to have a catheter in his tiny little kitty woohoo little tiny little kitty penis, right? The tiny littlest thing. The vet tech that had to put the catheter in him, I apologize, but that can't feel super great to have that put in and then pulled out. So there is some post pain management, and I think that we need to be thinking about that for our own patients. Well, we are not taking catheters out of them. We are taking some pretty major stuff out from between the tooth and the gum line. So some post pain management might be kind of nice. Now, on the flip side of that, when we're talking about medications and prior to doing anesthesia, I hope everyone's taking a look and looking at all your medications that your patient is on, what they're taking, and doing a review of that medication. And I know sometimes it's a tedious task. It really is a tedious task to have to go through and look all that stuff up. But the nice thing is once it's done, it can be very, very helpful. And if you have, if you're working with an organization that has someone that is making sure the patient's health history is up to date, they have someone that's inputting medications or has a medication list, if you can assign that off to someone, say, hey, can you look these medications up for me? You can, there's drugs.com, there's LuxTComp, lots of different places where you can look up medications to see what kind of drug interactions there might be with certain local anesthetics. The biggest one that is kind of causing some people question marks are the GLP drugs, like I said, the Ozempic kind of drugs that people are using to control diabetes, weight loss, those types of situations. Pretty much everyone in Hollywood, I guess, is taking it, so they say. So looking at that, it's one of those things of wondering, what is that going to be like for our patients when we're talking about local anesthesia? Right now, it looks like we don't have any concerns. It's more general anesthesia is where that question mark is coming from. But it's still, take a look at your medication list, look at your patient's medication list, and really look those up. So, all right. Oh, this is awesome. So, yes, I'm excited too. So, we over here over on Instagram, we had someone say, looking forward to meeting you and seeing you speak this week in Edmonton. Thank you very much. Yes, I am really excited. I'll be taking off this weekend, going up to Edmonton into Canada and getting to speak at the RDH Evolve event. This is a fantastic event and something that's been planned for quite a while, and I get to be one of the speakers there. Thank you to Septodont very much for being a sponsor for this for this course and allowing me to go up there and share some of my anesthesia insights with hygienists up there. I'm super excited about it. Very, very excited. So thank you. I'm excited too. So if you're going to be in Canada and if you're going to be at the RDH Evolve event, please come and say hello to me. My boyfriend keeps saying you should come up with some Canadian jokes. I'm like, I don't know any Canadian jokes. I'm sorry, I don't. So if you have some in Canadian jokes that I can share, maybe, I don't know. So friends, that's it. Check your patient's medications before you give them anesthesia. Make sure that everything plays nice. Pay attention to their health history, what their cardiac status is, if we have to take any changes in dosages for that. Remember, that is going to be where we put our epinephrine and put that on hold. Other things is to think about post-treatment pain management. Maybe you're going to do like a fluoride varnish, right? By the way, if you're curious which one I'm holding, this is the Profil Fluoride Varnish by Kettenbach. I love it. It's awesome. Hopefully you'll be coming out soon. I did a little article for them. So a fluoride varnish, some sort of mouth rinse that can help with post-treatment pain management like Orosoothe or Biovalence, something along those lines, okay? All right, friends. And I will leave you with this, and I loved it so much. It's a quote by Ricky Gervais, and it basically was relax. No one else really knows what they're doing either. And how true is that? How many times has there been something going on? We're like, I hope this works. I don't know what I'm doing. And I tell you, when I started these Tuesdays with Tina, I had no idea what I was doing, didn't know anything about social media, how to do any of this kind of stuff. When I started the YouTube channel, I didn't know what I was doing. I still don't know what I'm doing. And I'm sure there's a lot better way to do it. And I'm just saying, I'm out here. I'm trying. I'm doing my best. And I appreciate all of you guys who tune in, who share this message, because I'm just a hygienist trying to share my passion of pain management, anesthesia, medical emergencies, anatomy. And I appreciate everyone who supports along the way. And yeah. I'll see you guys next week. Cheers. Bye.